was unequal. Definitely unequal.
The current wealth distribution is rich and poor. Like, the rich are getting richer and the poor is getting poorer.
I think the majority of Americans are probably fall into that middle class category.
At this point, I'm a firm believer that the rich are getting richer and the poor are getting poorer.
I think the current wealth distribution, statistically, if I had to guess, would be 90% of the income controlled by 5% of the population would be a guess.
Not evenly distributed.
The rich gets richer and the poor stays poor. They're not able to come out of their rut that they're in a lot of times.
I feel like there are less wealthy people than there used to be because the economy has gone down. I feel as though the wealth has not been spread to the normal everyday people.
You see that there is a lot of poverty still in America. So I think in reality, there's a very small percentage of folks in the United States that have the bulk of the wealth. And I think the rest of us are either fall into the lower middle class category, to be honest with you.
I think probably 1 or 2% of the people probably control the vast majority of the wealth in the United States of America.
Well, we still have upper class, middle class, and lower class. And with the economy change the last few years, it seems like the lower class is getting lower.
Well, I know there are an awful lot of rich folks in the United States. So, of course, we hear on the news the 1% and the 99%. So, I assume that it's probably more of a 60-40 or 70-30 split.
There's a big gap, and it's either this or that, and we need to do something to help the people over here to be able to live comfortable. We're not trying to get everybody who's poor to be rich. We just need to make sure that everybody has what they need, their basics.
People. It's baffling to me. Just because I know that all of us as Americans work hard, and most of us don't even get to see a third of that pay.
I definitely believe that. I think that's a very accurate statistic.
It's not surprising. Again, the rich are getting richer, and the poor are getting poorer, and no sign of there being a bridging gap between either of them. The middle class is pretty much non-existent.
Well, actually, I'm not too surprised, because I know there are quite some folks who are really rich, and so it's not entirely too shocking.
There's 6 people, but yeah, you know what? At the end of the day, it's a corrupt system. I don't feel like we're entitled to anybody's money, but I also feel like it needs to be fair for every single person that is a hard worker to be able to have access to different avenues to keep growing. You have people with more money than you could ever imagine, and they're going through loopholes, and if he gets a break, why can't I get a break?
Hopefully they earned all of that wealth by hard work.
It's not great by any means.
I wouldn't find that to be that statistic. I wouldn't find that to be odd at all. I would pretty much expect it in this society. I wouldn't be surprised at all.
Outraged. I would be outraged to know that there are 6 people that has the wealth in the country. Ridiculous.
Would not be surprised at all.
I firmly believe there's a connection between lack of healthcare and lack of income, because right now the healthcare costs are driven so high, they pass those costs on to the patients. And if patients fall into certain income categories that don't allow them to get the prescriptions they need or procedures they need done, or be able to have access to those services, it makes it very difficult for them.
Lack of healthcare and lack of income do go hand in hand. If you are in the bottom percentage of the United States, or you're not in the top 6%, you virtually have to get what you can get. And that's sad to me. You shouldn't have to get what you can get. You should be able to get the same amount of healthcare all across the board without it being income related.
I do. Basically, I'm seeing and experiencing the more money you have and the better quality job you have better health benefits. And if you don't have a good income or a good job, you either have bad health care or no health care.
I think you're either able to pay the price for healthcare if you're in the upper echelons of the income bracket, or if you're in the lower echelons levels of those brackets. I think the people in the middle get squeezed. And I think that's just policy decisions, and that's just the way insurance is, and that's how it is. You have this gap in the middle that they're working people, they get up and work every day, but they don't have access to insurance or to healthcare. So you have the top and you have the bottom who have access, and there's a group in the middle that just have none.
Is to connect people to services they wouldn't have otherwise, and to help those that need the help the most.
It's that perfect line between citizens and the government.
To help people. I think there are different types of social workers. Some who work in, say, for example, hospitals, and also those who help the poor. You know, in other organizations, there are researchers who are social workers as well.
Bridging a gap for people who may need services but don't know quite how to get the services or where to go to get the services. I think that's really a great function of social workers.
The role of a social worker should be that of protecting the families and children and the well-being of the families and children.
Is to connect people to services that is unknown for the public and families.
To hopefully identify these people that may fall through the cracks and get them pointed in the correct direction.
I feel like they may be a little bit necessary in connecting, because too many people would not look for the information that a social worker can give them.
I believe they are because, for example, with the poor, I mean, where would they go? I mean, if they go directly to, say, a provider, that provider does not have their interests in mind. That provider is going to be looking at, getting as much money as possible. Whereas if they go to a social worker, that social worker, that's their job. That's why they're there, to help them.
I think social workers are necessary to connecting people to services because they're like a phone book, just like a phone book. If I need something, I go through the phone book in order to find out information that I'm not aware of. So yes, for sure.
I've never thought of social workers as being connected to healthcare services, but it makes perfect sense. The social worker is the mechanism for these services. So if health workers or if social workers aren't around, I don't know how people will be connected to them.
social workers play a very vital role in our economy and in our social well-being, and I think they're very important for folks to be able to connect to and have that relationship with somebody they know they can go to, and they can get the information that they need, and they can make an informed decision based on somebody that can provide good information to them.
Some people that don't have access to internet, to telephone, they're stuck in certain places demographically where they're not being paid attention. So being a social worker in that sense, you are their advocate. You can help them find channels to where they couldn't do it on their own.
There's a huge group of people that are just totally disenfranchised and disconnected, and social workers who are stretched few and far between have to, I think, should be able to identify them and get them to the places where they need to be.
Specifically, medical services that are needed are addressed by case managers. They will come in and discuss with the patients any aftercare that's needed, medical equipment that's needed, hospital post-op visits like home health services. They'll make arrangements for home health infusion or things like that. And this is really considered a social issue because a lot of times the patients don't have the financial resources to put that in place. So the social worker will look to see if there's any other resources if their insurance doesn't cover that, to make sure that they get what they need. I am a registered nurse. I work in a medical surgical unit at a hospital, a local hospital, and my connection to social workers are a lot of times the social worker will be hired as case managers, and they work alongside of nurses, and they're a huge asset to nurses. A lot of times as registered nurses, we are doing a lot of the clinical work with patients, hands-on directly with the patients. And because of that, we don't have a lot of time to address social issues, although we're aware that they exist. And we treat the whole patient, mental, physical, emotional, and social issues. That's part of our role, is making sure the patient has everything they need, and we don't have time to work on getting those social issues addressed. That's where the social worker or case manager comes in. We can alert them, and they can look into helping obtain resources for the patients. A large portion of my patients will require assistance from a social worker or case manager. Most of them will need some sort of assistance, and in fact, the case manager will visit every patient whenever possible, just to make sure there aren't any issues that are being missed. We work really well as a team, the case managers and the registered nurses, because they don't have all of the clinical information that we have, and we don't have all the social resources information that they have. And when we work together, it works wonderfully.
I feel like it should have already been in existence, to where we should have never had the thought of it being a right or not a right.
It needs to be a right, because I think in general Americans need to be able to take care of themselves and their health, but at the same time there needs to be control when it comes to the expenses related to healthcare in general.
I think we should expect in a country like ours to at least have minimal care, access to care. Our children shouldn't have to be sick. We should be able to get that kind of care in this country.
It's more of, I think, a social issue. It also tells you what our priorities are, too, as a nation.
I think it has to be people's right. If you have a country where everyone's just sick, it's not a country. It's it can't run.
I guess a personal responsibility, for people to be able to pay for their health care. But if they can't, then, society should step in.
I think it should have always been national health care.
As far as the Florida Department of Health, who we're a member of, it began 125 years ago. And it actually began in the state of Florida because of a yellow fever outbreak, a mosquito-borne disease that was going around, especially back in the late 1800s. State decided that they needed to form a Department of Health that would help protect the health of all the citizens within the state. The Florida Department of Health is a state agency. So every county health department are all part of that Florida Department of Health. So we're now officially known as the Florida Department of Health in Orange County. Probably would be women and children. That's probably who we serve the most, but it can be just about anybody. The majority of our clientele would be those folks who are in need, those who don't have insurance, or they're underinsured. In other words, they might have some insurance, but it doesn't cover everything. And I say women and children mainly because we have services, for example, like women's health, where we do prenatal care. So women who don't have insurance or are underinsured would come to see us for prenatal care when they're pregnant. We also do family planning. Also, we have WIC, which is Women's, Infants, and Children, a separate program, but again, it's geared towards providing services for women and children. And then Healthy Start is another example of that. These are women who have had children or are pregnant, and it's providing services so that these babies have a healthy start.
I work for the Healthy Start program, which is part of the Department of Health. The Health Department receives a contract from Healthy Start Coalition, and the coalition actually is the one that has the social workers and the nurses working for Healthy Start through the Health Department.
The biggest piece that I would tell you that we do is disease control. When we talk about 125 years ago, yellow fever, it's those kinds of things, what we call epidemiology. We take care of people, again, with no insurance. And if they don't have insurance, then we have services that are provided for free. Or there is also a sliding scale of fees. We're here as a safety net for those folks who don't have a way of getting health care coverage. The rates of uninsured are, in many parts of the country and even in Central Florida, are high. They're trying to, of course, improve with that with the Federal Health Care Act. Certainly there's a correlation there, and that's, again, why the health department is here. We do know that when people don't have insurance or they don't have the income to pay for health care, that certainly they're most likely not keeping up with their regular health checks, annual exams, those types of things, and then usually it's reactive instead of being proactive and preventative. So certainly there's a correlation there, and that's something, we hope that's going to be improved over time with just hopefully more access to health care for everyone. Our mission is to protect, promote, improve the health of all people within the state of Florida, specifically in Orange County, through our efforts and through partnering and through these efforts.
I feel like healthcare should be connected to a person's employment, and everybody should have access to inexpensive medical coverage through their employer. That way, we all have access to go to the doctor if we need.
I believe it should be connected because in my case, for example, I work for an agency and we pool our money, and that makes our premiums low and affordable. Whereas if, I come in as a single purchaser, my premiums would be crazy. And so, connecting it to work, that will allow more people to be able to afford it.
Healthcare should not be connected to a person's employment, only because what if a person is between jobs, or, healthcare should not be based on if you have a job or not, or if you can afford it. It should be available to everyone.
Companies, I think, traditionally have used this type of a benefit as a way of attracting qualified and better workers in an environment where there was a lot of qualified people competing for the same jobs, and employers were using these benefits as a way to attract them into their organizations and into their firms. I don't think it was because of there's any really philanthropic reason for them to do that. I think it's to their best interest to do that as a benefit to attract qualified people. But I just don't seem to feel that that's incumbent upon them morally.
Healthcare should not be connected to a person's employment because there's a different spectrum all across the board. No one can afford what the upper echelon of people can afford, but they shouldn't, because they can pay their medical bills, they shouldn't be allotted amazing insurance on top of it. I have been self-employed for 13 years. I am 32 years old, and my healthcare, I'm completely healthy. My healthcare has been, on average, $175 per month. No maternity coverage, no prescription coverage, no preventative doctor coverage, nothing. That's basically catastrophic insurance with no other options. I am now available to get Obamacare. And so far for me, it has been wonderful. My premiums are a quarter of what they were, and I have a platinum plan. The services I now have access to, I have full maternity coverage. I have complete preventative. I have dental, which I've never had before, was included in it. And I have lower for vision.
I think that the lower life expectancy of citizens of the United States probably does have, is impacted by the fact that there's a lack of health resources available to people. I think that if people had more access and education about preventative care, that could probably do a lot to help to make those, improve those numbers.
That's an alarming statistic, actually. I would have never imagined that. I wouldn't say we're the most healthiest country in the world, but there are a lot of countries out there that basically have a flat tax rate that allows folks to basically, in other words, have free health care, free health insurance from the government. But then their flat tax rate might be like 40 or 50% of their net income, or gross income, I should say. So I think healthcare in America has been an ongoing issue for many years, so the correlation there is probably very strong. There are a lot of folks that can't afford healthcare, so they can't afford to get their checkups every 6 months, or their checkups once a year, or they can't afford specific procedures like mammograms or colonoscopies or whatever examples for that may be, because the costs are so overwhelming. So that actually makes sense, and I believe that healthcare has been a major problem in the United States for many years. And we as a country, as well as the citizens of the United States, have a due diligence to try to figure that out, hopefully sooner rather than later.
I'd say yes, there is a correlation there. Because if you don't have access to health care, then that means, of course, that is going to determine what your, in a way, it's going to determine what your life expectancy is going to be. If you don't have health care and you're poor and you can't afford it, of course, then you aren't being tested and, taking care of yourself, basically. And so, if you get sick, you may not know it for a while, and by the time you do, get it addressed, then it could be too late. If we don't, as a nation, care about those who are down at the bottom, then that doesn't bode too well as far as, what type people we are.
I'm very surprised that we are supposed to be the biggest country with the best access to health care and all this stuff you hear. The fact that we are our average life expectancy is 11 years behind the highest is really surprising. I think that is just more proof that the fact that your financial situation has a direct correlation to healthcare is a problem.
Healthy Start was actually initiated, through Tallahassee. I guess Governor Childs, his granddaughter, had a baby, and the baby came out early. They came up with like a list of risk factors that they felt that would, possibly, have something to do with premature birth. After they, formed Healthy Start, It actually, some of it got funded through the federal government. So the federal government does actually provide some of the money to Tallahassee, and then Tallahassee gets the money and then spread it through the whole state of Florida. Our vision is for us to have healthy babies, and for parents who have just had babies, for their babies to be healthy, and to provide them with information and support so they know what to, how to take care of their children. I graduated in '92 from UCF and with a bachelor's degree in social work. When I first started in school, I was really going to go into business. But then I said, I think I would like to help others. I felt that social work was that niche that I was looking for. Social work is for a service or being able to assist others to, receive services that they may need. They may not be aware of, what the procedures are and how to, to obtain those services. Most social workers, as they continue in the field, they become a little bit aware of everything so that they'll be able to provide that information to their client.
Social workers work with people who need empowerment so that they can be able to access all the rights that are available to them. And clients might not know of them. So social workers are important because we help link those available resources, available rights, so that they have the right to use them so that they can better off their life. I think social workers are working with the clients so they see what's going on, what is needed, what resources need to be advocated for the clients. We know what's going on, so social workers play a very important role. I think it was just what I always knew I wanted to do. I mean, it seems so right to always help people better themselves. Field placement is, I think, the best thing for social workers because the field work is what brings everything that you learned at UCF into perspective. And you see it, and you feel it, and you know it, and you learn from it.
Well, with Healthy Start, we have childbirth classes that we offer. We have breastfeeding classes that we refer a person to, which is through the WIC office. We have daddy boot camp for first-time dads. And then we have like car seat classes. Making sure that the car seat is safe inside the vehicle so that the babies are safe, we also provide car seats, which is through a grant. We provide home visits so that we provide supports. During the pregnancy, people, if it's their first time being pregnant, they may not be aware of how to be pregnant or what is the signs of preterm labor signs, when they need to go to the hospital. We kind of follow them all the way to their postpartum, to make sure that they have Medicaid for the baby or some type of insurance. Any kind of social service agency that's out there, if they don't find information, we'll find information so that they'll have it, so they'll have access to it.
Rachel helped me. She referred me to Dr. Blunt, and she was helping me gain access back. She's been doing Healthy Start with me, and I was talking to her, and she realized that I didn't have Medicaid no more, so she helped me connect. The difficulty I had with accessing Medicare is when I turned 18 and it shut down because I was pregnant. My Medicare shut down, and I couldn't be able to access Medicare to go to the doctor during my pregnancy for like 2 months. Sometimes I would have pains and different stuff, and I wouldn't want to go. That would kind of say I don't want to go to the emergency room because I don't want to be filled back that. stuff. So it didn't encourage me to go even if I was in pain. So sometimes I would sit through the pain and I would call Rachel and be like, oh, this is happening. And she was like, do you go to the emergency room? No, I don't want to go because, I don't want that expensive bill. I wasn't sure what's happening. I wasn't sure anything. So I had to feel my way through it. She actually personally made the calls when I needed them to Dr. Blunt and different various doctors and talked to them saying that I needed Medicaid and I didn't have them. And if I wanted temporary Medicaid, she referred me to a place in Apopka that would give me that temporary Medicaid so I can still go during my pregnancy. When I didn't have Medicaid, she made me feel safe because she would always come and visit me and answer any of my questions and follow up if I'm taking my prenatal vitamins. And I felt like she was my mini nurse. Oh, I always had to, when I was pregnant, go to the emergency room, and it would be a longer wait because I didn't have anything, and they would always keep on sending me these bills, and I didn't know how to pay them. But as soon as I got the Medicaid, I could have been able to transfer it and say, this is my Medicaid number and stuff like that. And it really helped me out because not everybody have money to pay for the expensive bills, and you have other needs and other things that you need to be able to do, and nobody has that money. So when you feel like you have Medicaid, it's easier for you to go about your day. When you have help, you feel like you're able to be strengthened again. It's really emotional support, and it's also physical support because I felt like I always had to go to an emergency room to be seen by the doctors, but when I had medical care and the more attention, I was able to be better off.
Usually we stay with them for about 6 weeks to 2 months, just to make sure that they completed their postpartum. We talk about birth control. It's really important that they space children out at least 2 years apart so that the next baby will be healthy. If the baby had concerns or the baby was born early, had breathing problems or something, we may transfer them to one of the nurses and help you start. And they could probably follow them up to 3 years.
Anything I needed, like if I needed crib or anything, she would refer me to different places that would have those services. And she would bring me small gifts and be assistant to me, and any questions I had, she would go over them.
That's why social work is really important, to assist those who cannot help themselves.
Rachel is the best.